Hi, this is Abdul. In this poster, we will be looking at angiographic pitfalls for pulmonary arterial interventions. Here we discuss three cases of potential pitfalls that someone performing any sort of pulmonary arterial intervention or cardiac intervention may encounter. The first one being a patent foramen ovale in this patient that was being treated for pulmonary embolism. The catheter for thrombectomy was used to access the right side of the heart, and as it turned out, we saw contrast going into one of the pulmonary veins, and retraction of that catheter showed in the aorta. And what had happened was the catheter had gone into the right side of the heart and through the patent foramen ovale as a result of the elevated pressures from the pulmonary embolism. And so the catheter was retracted and repositioned. It's important to note this potential pitfall as any sort of injection, such as like a bubble or other abnormality, may actually go into the systemic circulation and cause a stroke. The second pitfall we discuss is access into the coronary sinus. In this patient that was receiving thrombectomy for pulmonary embolism, catheter was noted to be in coronary sinus. This is a more common pitfall seen with patients undergoing cardiac catheterization, having to do with the anatomy of the coronary sinus, but it is able to be accessed, and clinicians performing pulmonary arterial intervention should be aware of this possibility. The third pitfall that we present is a result of anomalous pulmonary arterial anatomy. This patient that had a pulmonary embolism ended up getting a pseudoaneurysm due to the access of the pulmonary arterial anatomy. This patient ended up having anomalous vasculature and developed a pseudoaneurysm and subsequent hemoptysis. This was subsequently coiled and the patient's symptoms resolved, but this served as a reminder of evaluating anomalous pulmonary vasculature.